Hi, it's Dr. Hillary Hashawa from Rangeline Chiropractic. Today I wanted to hop on real quick and talk about scoliosis. I do see comments if you want to leave a comment or a question, and I will be recording this so you can watch it later also. So, scoliosis, that term gets thrown around. Do you remember when you were younger and you had the check in school and you had to bend over and they kind of like palpated your back by a nurse and she would say, like, yes, you have a curve and scoliosis or you don't. Those are why they can be somewhat accurate. They are not often the best indicators. And I have had patients that have been checked and then I take an x-ray and I'm like, oh, wow, this is more advanced than we thought. So if you feel or see, let's say even in your child, a curve in their back, the best thing to do would be to bring them to a chiropractor. A lot of patients tell me they have scoliosis or they thought they had scoliosis as a child. But in all reality, it was a curvature in the back. So a scoliosis is different than a curvature. So I'm going to try to show you an example. A curve would be like the spine is curved a little bit. A scoliosis is that it's curved it's very accentuated, and it can happen in like the middle upper back down to the lower back. Curvatures only I've seen are mild, and I find them mostly just in one area, whereas a scoliosis like really makes like an S curve. So again, the best way would be on an x-ray. So like in our office, we do digital x-rays. They're very low radiation, and then I don't have to guesstimate what's going on or where it is. So how can a chiropractor help with scoliosis? I get that question a lot. Chiropractic, what we do is we assess what's going on with it. Oftentimes with curves or scoliosis, there is one side of the spine that's tighter than the other where the curvature is. So most of the times we're doing things to alleviate the tightness, which will then give patients more range of motion, less pain, they'll be able to breathe better, and their posture will change. So what we do is we fix what are called subluxations of the spine. And that's when like two little vertebrae are like twisted out of place. Like one might be going this way or that way or towards you. And what we do is we gently pop those back in place. With a scoliosis or curvature, it's not something that you go to the chiropractor and we pop everything and we straighten it back up. So it's not like a quick fix. Now, we have had some cases, and I have seen cases that chiropractic care can correct that curvature. However, when someone's gotten to a point of severe scoliosis or a pretty good curvature, what I do is I maintain it. It's best to catch these curves and scoliosis prior to puberty is a general rule of thumb. However, there are certain clinics that only deal with curves and scoliosis that may have better programs that involve rehabilitating the muscles. So there's certain things that you can do as far as exercises to strengthen the back. Whereas like if one side is tight and one side is weak, we're going to focus on strengthening the weaker side and then loosening the tight side. So that in fact could relieve that pressure off the curve and the scoliosis. So those are things chiropractors look at and assess. Some people have like the muscle tightness, the strains due to the muscles in the curve. If you ever notice like one shoulder is higher than the other, or like your pelvis, like where your pants sit on and your belt, and you look and it's like crooked, or you have one leg of your pant that needs to be hemmed more than the other, or it drags more, or it's frayed on the bottom. These are indicators that you have some misalignments and possibly a curve or scoliosis, and then you could come in and we could assess that. So it's not really something that's a quick diagnosis by just feeling the spine and having the nurse go, yep, you do or you don't have scoliosis. The best way is via x-ray. Another thing I want to talk about is that you can have like neck pain and shoulder pain and headaches also due to these curves and or scoliosis. So sometimes that's causing other issues. So it needs to be addressed as to what is causing the problem. There's most commonly, there's scoliosis that are like an S shape like I was talking about. And then there's also another one that's more rare, but I have seen on x-rays with some of my patients. It's called a rotatory scoliosis. And then the vertebrae themselves are like rotated. It's not a curve like an S shape, but the whole thing is like shifted and rotated. And again, you might not feel that upon like palpation of the spine because it's still a straight spine, but it's rotated around almost like around an axis, so to speak. So that's the rotatory. So there are some patients that have scoliosis so bad that have to have surgery. Obviously, we would try to prevent that. There's rods that are placed to straighten the spine, and when needed, that is what's needed, right? I've had patients where I've tried to help and correct, but it wasn't enough, or they were too far into the scoliosis that it didn't matter what I was going to do. And that's just a simple case of referring out for that. So bracing. Some patients ask about, well, should I wear a brace for the scoliosis? There's actually some specific scoliosis clinics that brace specifically to help out the curve and possibly reverse that curve in this signs of the scoliosis. I remember I had this one patient when I first started in Carmel, and she was I think she was probably in her 70s or 80s. And I did not know her whole history. However, she had like the most severe case of scoliosis I've ever seen. However, she said that she was going to a chiropractor since she was younger, and that's really what kept her mobile. Like, I was surprised how well that she got around with the scoliosis, because it can affect your lung function. And she was so curved and hunched over. It was so amazing what the body does. Obviously, she probably didn't feel that amazing, but she did a credit to her mobility and her long life to chiropractic. And she had from a young age known, obviously, that she had scoliosis, and her parents had taken her. And I just thought that was wonderful. And when I took x-rays of her to see what it looked like, obviously it was there, but the amount of degeneration and arthritis wasn't there as I had expected it to be. When they're so curved, they kind of like grind and wear down. Think of it like a car tire, and we rotate our car tires to prevent the wear down. If your spine is wearing down, it's like causing that like degeneration and arthritis. The discs in between all the joints are going away. So on this model, these like clear spots are the discs. These can get smaller, and in some cases they go away, and then the bones fuse together. So chiropractic is known for preventing that. It doesn't fix it, because once it's gone, it's kind of gone. But the prevention is key. And I was so thrilled to have her as a patient and just see firsthand what chiropractic had done, even though I wasn't her only chiropractor. Obviously, she had been going for, probably 80 some years. And she just, did her wellness tune-ups because she just knew that's what she needed to do. And she had to get back out in her garden and keep walking and doing all her stuff. So other things we do in our office for scoliosis and tight muscles in general, dry needling. So I do dry needle a lot of my patients with curves and scoliosis, again, because one side of the curve is tighter than the other. And so I will stick the dry needling into those trigger points to loosen up that side of the spine to relieve that pressure off. So the maintenance of the curves and the scoliosis to reduce the tightness, keep the spine lined up as correct as it can, so it's not wearing and grinding down in certain spots over time. That just causes more issues. Another therapy we do is cupping. So we stick little suction cups, and they kind of cup up the muscle underneath it. It breaks up some adhesions. It brings blood flow. So the whole point is to reduce the tightness associated in the area. And also exercises. We do a small amount of physical therapy-esque type exercises at the office. So we can show patients how to do more like one-sided stretches, one-sided exercises. And there's certain things we can do for that. So chiropractic in general is a great starting point for scoliosis. I definitely can't say we are the end-all be-all for all scoliosis and curvatures for the patients. However, we are well equipped to assess and handle and treat scoliosis. So the more you know about it, the better. You might have someone in your family. Feel free to send them this video if they have any questions, to follow up with us. Follow us on Instagram at rangelinechiropractic.com, Facebook, and our YouTube. I'll be uploading this to our YouTube channel for Rangeline Chiropractic. Contact me or other associate, Dr. Taylor, and we'd be happy to even chat with you over the phone if you have some more questions about how we can help with scoliosis and curvatures, and if you're ready to get yours assessed. Thank you for watching.